Hello, everyone, and thank you for viewing our track orientation presentation. My name is Katia Shell, and today Evelyn Gallego and I will be presenting the track orientation for the care coordination track. So today we're going to cover Connectathon overview. We'll give an introduction to our track, some valuable communication tools that will help you during this virtual Connectathon, other considerations related to virtual Connectathon, and we'll talk a little bit about the report out. So the Connectathon, specifically the FHIR Connectathon, is a great opportunity to learn about the FHIR standard and engage with fellow colleagues who are developing and testing systems using this standard. Testing at FHIR Connectathon is also a prerequisite for implementation guides and resources. For this session, for this September Connectathon, we will be virtual, and for those who were here in May, we used Zoom, but we are also now going to be using the Whova platform. You will receive an email from HL7 or Sandy that will give you a link to this Whova app. It's an app for your mobile device as well as a web browser app. Please do not share this URL with anyone else. And later in the slide today, I'll show you what this platform looks like. This is how you'll connect to your tracks or the care coordination tracks and access the Zoom through there. For the Connectathon, this is a highlight of what you should expect for the 3 days. So the first day, Wednesday, the kickoff will happen at 4 p.m. Eastern Standard Time. After that, Thursday will be the main testing day, Thursday and Friday, but there will be wrap-up sessions and highlights during the Friday session. So stay tuned for that. That's a great opportunity for observers who just want to get a sense of what happened on the track. And for your awareness, the standard hours for the track are 9 to 7 p.m. unless stated otherwise on the respective track proposal pages. So they have a couple of special sessions for people who are new. There's an intro to FHIR on Thursday, September 10th at 9:30, and then there is a FHIR testing tooling session at 11 a.m. And like I stated earlier, there are going to be highlight sessions. They're 15-minute sessions. A schedule will be on Whova, and it's for you to come and see the different tracks. They'll introduce their use cases, implementation guides, and some may even do a demo.
Great.
Now I'll turn it over to Evelyn.
Thank you so much, Katia. Hello, everyone. So I'm going to go over the details for the care coordination track. So introduce who we are and our track, the track leads, describe it, its goals, what our roles and preparation are for it. We'll talk a bit about some breakouts we can have, list of participants to date, and of course, how to find a test partner. Next slide. Here are our track leads. So myself, Evelyn Gallego, with Gay Dolan, who serves as the FHIR IG developer. We have Jerry Goodnow, who is the Smart on FHIR app developer. And you heard from Katia, who supports us overall and will be has joined me on this presentation. Next slide. Here's our link to our track. So if you haven't seen this already, we encourage you to go directly to the care coordination track overview. We will be using this landing page to communicate everything about the track, where to find us, details. So of course, peruse there first, and this presentation will be posted there. Next slide.
Would you like me to open up the page?
Yes, please. So as Katia does that, so we'll acknowledge what the track is about. So the track is very much focused on testing the Multiple Chronic Conditions, MCC, or Electronic Care Plan that is being developed on a Smart on FHIR app, provider-facing app, alongside the FHIR implementation guide. So this will be the first time, as noted here, that the Smart on FHIR app and the FHIR IG components or profiles will be tested at the Connectathon. This differs from the previous care coordination track that was conducted in May of 2020. This track is geared towards just testing the MCC e-care plan, and we'll go through the details. But as noted here again, this track page gives you an overview of the of what we'll be testing, the purpose of our work, our goals, and then as you scroll down, you'll see that what it's linked to. We have relevance to other projects, of course, so we recognize them. And then list all our current participants, our artifacts, related track information, who we expect. We do have a Connectathon attendance sheet that we'll go over in the coming slides, our ZULIP information, our planning. So we've had planning meetings. So for those that are just joining us for the first time, just note that we've been planning this for a while. So you'll see our information there, but you'll also note that we have detailed activities planned for the Connectathon from the 9th to the 11th. So you can follow along as well, and then you'll have the recording for this presentation. System actors, and then the scenarios. Again, lots of detail, and we'll go through each the links of these in the coming slides. Okay, so what will we be testing? So we've identified 9 scenarios for this track. Again, very much focused on testing the components, the profiles relevant for creating, updating, and rendering an MCC e-care plan. So the scenarios listed here is the first one is the ability to actually retrieve a chronic kidney disease care plan from an EHR. The Multiple Chronic Conditions project is focused on 4 chronic conditions. Chronic kidney disease is the first one, with the data sets and value sets are already developed for CKD. We're working in parallel with diabetes, hypertension, cardiovascular disease, and pain and opioid or pain. So those will be coming in future iterations. This FHIR IG will not be valid during this cycle. It's not validated for another 2 years. So we have lots of time to test. So here, what we list as the 9 scenarios is really the ability to retrieve and render, right? So query out, find it, render it in either the app or the EHR system, and just demonstrate its use. We do not have enough experience testing all of these together. So it's a great time to really build a comprehensive care plan. So the first scenario is actually retrieving the care plan. So we'll have an existing care plan to work from, and then we'll update it. So we'll update it based on a health concern, supporting information from a transition from a stage 3 to stage 4 of chronic kidney disease. Then we'll look for and update it with relevant labs from the electronic health record. So the scenario 3 is the Smart on FHIR app actually conducting these transactions. 4 is, we call it a bonus. We're in the process of figuring out of getting the medication statements, but we'll also look at retrieving a medication statement to update the care plan. Then scenario 5, very relevant for other, you'll see we are aligned to other tracks or relevant tracks. The ability to retrieve a completed questionnaire or assessment. In our case, because we're interested in pain is one of the other MCCs, we're going to query pain perception and also use that to inform and update the care plan. Scenario 6 is retrieve their chronic pain condition from the EHR and add to the care plan, so building off number 5. 7 is retrieving their weight observation that is relevant from our patient story that they're going the encounter and adding it. We'll also update with a weight goal. And then lastly, also a bonus is the ability, because based on that and the goals identified through this process, that we would like to test a referral to a dietitian using the existing HL7 FHIR bidirectional service e-referral, FHIR IG or BSER. And we list these both as bonuses because we'd like to test them, but we know we may not have the capabilities to do so, depending again who signs up. And so the link here is these track scenarios. So if we can click on that, let's go over to what that looks like, because this is where you can see all the get statements. So we've basically outlined each of these. And again, these are available on the track page. So when you click on that, it actually brings you to the track scenarios, all the resources needed, where they're located on the GitHub, what the get statements are, the code. So these are all very much, you know, it's your recipe, it's your direction on how to be able to test this. And we've tried to make it as straightforward as possible for all the new implementers or new FHIR testers that are joining us. And of course, if these aren't the right ones, or, you know, if they're not rendered the correct way, we need to get your input on that. Great, let's go to the next slide. So the use cases. So our work is garnered, I guess, is stabilized around these three overarching use cases, as you see here. And we do recognize we have also, we have actually a total of 7 use cases relevant for the MCCE Care Plan FHIR IG, but we will be only focusing on 2 of these for testing, and our work so far. But the FHIR IG right now is focused on 3 use cases. So it's the ability to generate or update a care plan in a clinical setting, and the ability to expose components of these to a clinical care team and or the patient and the caregiver. And then we'll also work through identifying care team members. We'll work on 2 and 3, use case 2 and 3 more for the January 2021 Connectathon, but we want to highlight that these are the important use cases that are existing in the evolving FHIR implementation guide. And the link is here at the bottom for you to peruse. Next slide. We go back. All right, so our track goals. So as I mentioned, we have 3 use cases. We do not assume that we can test all of them for this one. We've prepared very much for these main 2 here, which is the ability to generate and update a care plan and then expose it. So really this is where the APIs are. If there are others that want to connect and retrieve it from other systems, of course, but these are the goals for us. A stretch goal, though, to align with another track, the care management track, is that we'd like to look at testing specific transactions like retrieval of a clinical practice guideline and questionnaire. So this is very relevant, again, as well as the pain questionnaire, if it exists in another system, so not in the actual EHR, but in another hub or in another, you know, not connected system. And of course, the clinical practice guidelines that exist right now for care planning. Next slide. Okay, so what are roles? So we've identified 3 roles, system actors for this Connectathon. And as I walk through the use cases, they're relevant. So we're looking for a practice management EHR, so we call PM EHR, that would be representative of a clinician's or provider system in a primary care setting. We're looking for a provider app. So this is, I mean, we will have a provider. We'll have both a PM EHR and the provider app. This is the Smart on FHIR app that works with the PM EHR to query and render care plan data. We also have patient apps, so the ability to see this data. So those are the 3 actors. Primary actors would be the PM EHR and the provider app, but we also have some interested participants that to be able to access it from a patient, the patient system. So how do you prepare for this? So for one, we definitely encourage you to look at and review the existing FHIR IG. So the link is there. We all have the care plan data. So as I said, we'll start with an existing CKD care plan, and that's available on the GitHub. And then we're also looking to connect, like as I mentioned, the scenarios will exist, but you have the ability to actually render it or query that data or post to a hub, as an example, that can serve as a data aggregator or a health information exchange system. So please contact us if you are interested in connecting to the hub. Next slide. Okay, so who are the participants in this track? So we will be, our work is based off the Logica server. So this is where all the, we'd be able to find the care plan, everything is posted there. And here are existing clients. So we have MaxMD that will serve as the patient app. We have patient-centric solutions that can will serve as both the PM EHR and the hub. Patient Link Enterprises will be the patient app. And of course, as part of this project, the ARC and IDDK e-care plan, we will provide the Smart on FHIR provider app. Next slide. So I'll hand it over to Katya to go over order of operations.
Great, thank you. So now I'll kind of walk through what participants can do to be prepared for a Connectathon. So first, hopefully you are already registered, but if not, please register. And I think the slides coming up will have a link for you to access the registration. HL7 also has a survey for participants, and they would appreciate you take this survey, and that's where you can note your level of experience for Connectathons, if you've ever attended before, and what track you plan to attend. As we stated earlier, you'll get a link to Whova once you do this, and you can see the agenda and the times that the sessions will be. And important to note again that you'll only have access to the Zoom through Whova. So here is the registration cost and the link to register: $250 for members, $350 for non-members. Next. So HL7 did a listening session this week, actually on Tuesday, and it is already posted. You can check that out. It was a really good session. It has information like we're sharing, but other little details that I think will be helpful for people this time around. So please go access this link and listen to the presentation. Okay, so how we're communicating during the Connectathon, we're going to be doing this through Zulip. Zulip is a free app, so I encourage you to download this app. I know it's another app, but because we're moving virtual, this is the easiest way we can engage. And so we have our care coordination Zulip stream linked here. So if you have any questions, you can go there, you can ask the track leads, you can ask other people actively talking on Zulip. And another way to get your issues or questions addressed is to log a tracker on Jira, and we'll talk a little bit about that more in the upcoming slides. And again, your track leads, Evelyn or I, can assist if you have any questions. Okay, so I'm going to take some time to kind of walk you through what Whova looks like. But first, you have to get the link from Sandy. Again, do not share your link with anyone. When you open that link, you'll see a picture similar to what we have on the screen. And there you can either download on your phone or you can do the web browser. So there is an option to download the app on the web. You will get an email encouraging you to do the mobile app, but according to the email, what you would be missing is people's profiles and their interests. So if you think you can function without that, the web browser is just fine. And I'm gonna come in here. This is what it will look like once you log in. Please use the same email that you used to sign up for Connectathon to try to create an account. You will not get access if you use another email. And please also use Google Chrome. It only works on Google Chrome. And so here's the home page. And so you're going to come in here on the day of Connectathon, and what you're going to look for is the agenda. And so each day there's an agenda. So let's just skip to Thursday because that's the main testing day. And what you would do for us is you would look for the care coordination track, and then you would go to view session. And that's how you're going to get access to the Zoom. Of course, we're not on the Zoom right now. That's why it says that. But on Thursday, that's what you'll need to do. So I'm going to exit out of that. And then also you can look at our track page. You can look at the Connectathon track page. They have a lot of good information there on how to prepare yourself for the Connectathon. And then FHIR chat is also a useful place to get additional resources. Okay, Zulip. I'll talk you through Zulip, and I'll show you not only our care coordination Zulip track, but I'll show you how to connect to this Connectathon management track, because HL7 is requesting that you follow that just so you can get a sense of what's going on during Connectathon. So I'm going to open up Zulip. Again, this is free. You can create a login and you can download it. And right now, I think I'm showing, hopefully it's showing, the care coordination track. And I am already streamed on care coordination, and I'm also already streamed on the Connectathon. This is our care coordination Connectathon stream. You'll see our last post was in May during the Connectathon. So if you're new and you just got on here, you're not going to have any streams you're connected to, but this is how you would connect. So add a stream, and then they're going to give you this drop down and you can search a filter. So they told us we need to connect to Connectathon management, which is right here. You would just press that check button, and I am subscribed. If I wanted to subscribe, I would unsubscribe, or I can just go and view the stream here. So it's pretty simple. That's how you'll connect to any stream that you're interested in. And we will move on to the next slide. Okay, I think it's back to you, Evelyn.
Yes, so thank you, Katya. So for those that are new to FHIR and new to the Connectathons, we strongly encourage you to participate in the Intro to FHIR session that will be scheduled Thursday, September 10th from 9 to 10 a.m. So it'll be okay, although we'll be starting our testing at 9 a.m. We do encourage participants that are new to FHIR that really want to understand it. Please take advantage of this opportunity. You've paid for your Connectathon. You have an opportunity to take advantage of these sessions that really do a nice job of introducing the specification and how you can use it to support interoperable data exchange. Of course, I'm Evelyn Gallego. Please reach out to me should you have any questions. And any additional, overall questions should go to Sandy Vance, who's the HL7 Connectathon administrator. So her information is there as well. So anything that is HL7 Connectathon related, please relate to Sandy. If it's care coordination, relate to me, contact me, Evelyn. Next slide. So next are our useful skills. So again, those that are new to FHIR, I love using the analogy of a FHIR IG as being a recipe, right, on how to create or build something. And so like any recipe, it consists of ingredients, right? So all the FHIR resources and profiles are those ingredients, and the IG tells you how to put them all together for a specific outcome. The same is with here, as you prepare yourself. To bake anything, cook anything, broil anything, you need to have things in place. This is what you need to be aware of, so familiarize yourself with the basic technologies like REST-based APIs and conventions, inspect and understand the HTTP protocol. Also, of course, general healthcare system clinical concepts. So there's a lot of these things that are available that you can prepare yourself in advance. Of course, please reach out to your track leads or to the administrator should you have any questions. Next slide. Other FHIR interaction. So again, very much how do you interact with other connection points or endpoints for FHIR. So again, very useful for those that are new, as well as those who have tested before and felt like they needed a little bit more information. So the link is there, and please do peruse the site so you become fully prepared and take advantage of the day. We truly only have one full day or 1.5 days of testing. So this is really to optimize your experience and your ability to test FHIR with your respective systems at this event. Next slide. Here are variants. So also 2 is becoming familiar. We are using a variant, SMART. So of course, we'd like for you to understand that more and be familiar with it. CDS hooks, clinical decision support hooks, are very important for this work, especially for e-care plans. And that's being tested in the care management track, not the care coordination track. So yes, of course, if you're not familiar with these, have a basic understanding, because these are things that how the care, we would say the MCCE care plan will evolve to be able to support CDS hooks. Next slide. Of course, I would say the overarching goal of all Connectathons is to validate the existing specifications. And if there are issues with them, we need to track them so we can improve them. So JIRA, if there are items that come up during the Connectathon, we will track them. So we'll go through how we'll be able to track any issues that arise. We then have to post them or enter them in JIRA. JIRA is our issue management system, you know, and so we'll have that, we'll be able to track that as part of our report out, any issues that arise, so then we can enter them in JIRA. Next slide. So how do we enter them? So I mentioned this track. So we are required as track leads to report out on our track experience. And we have to include these areas. So, you know, what was the track trying to achieve? Well, we need to track all participants. We encourage those, especially with their organizations, to submit their logos or enter their logos. Notable achievements. So this is where we will have a Google sheet, and I'll go with that shortly, but it's really to be able to in real time track any achievements. So if there's something you're able to accomplish as part of one scenario activity, we want to immediately add it to the track report out so it's listed as an achievement. Of course, tracking any screenshots, we'll try as track leads to take photos, you know, screenshots throughout and put them on. We'll also be recording. And then of course, discovered issues, questions, as I mentioned, those will be tracked for JIRA if they're specific to a specification. And then of course, now what? We also want to track lessons learned to improve the next Connectathon. So with that, if we can just go through a screen, the link here is the track report out. And this is what it looks like. So we already have a skeleton in place. So we can hit the ground running with tracking, but it has the information here. We'll encourage you, again, as we have new participants, to list their names and their logos. We'll add systems. So again, these are all the placeholders. The template is ready to go for our report out. And we will have report out scheduled on the Friday, September 11th. Report outs are scheduled in the afternoon. And what a report out is that we gather all this information. We'll try to complete this report out template on Friday morning. And then we will slot a time Friday afternoon where we go and present this, right? So the track leads present this back to HL7. And what HL7 does is then records them and has them available for others to peruse later on. Next slide. So just a recap of the checklist. So again, just if you haven't, you know, of course, register, access the Confluence, become familiar with Confluence, you know, pick your track. This is the care coordination track, complete the pre-connect survey. This is, again, is just listing which tracks. You may be participating in more than one track. So that is up to you and how you balance between multiple tracks, but you have that. And then sign up if you haven't. Katya went through chat, the Zulip, and also there's the chat.fhir.org. Of course, prepare yourself. As I said, we have lots of homework for you too, so you hit the ground running on testing day. And of course, connect with myself and the other track leads I walk through. Next slide. Again, so we will end. If there are any questions, please reach out to myself, Evelyn, and Katya, and we are here to answer your questions before the event, during the event, and of course after. And with that, we'll conclude. So thank you very much.
Thank you, everyone.